In many ways, a hospital is the flagship of a rural community. After all, it's where we care for our friends, family, and neighbors when they need it the most. Although we've made do, it's important to remember that our current hospital was constructed during the early part of John F. Kennedy's administration. During those years, minor updates have been undertaken, but over a half a century of service has taken its toll. The community of Power County has been called upon and has been generous with updates of several other important community facilities that were also in need. Now we're asking the residents of Power County to help us make an important investment in the future of our healthcare services. Our goal is simple. We want to meet your expectations for a modern, comfortable, convenient healthcare facility that will allow us to care for you and your families for the next 50 years.
As a long-term resident of Power County, I'm pleased with the level of interest that our community members have shown in our renovation plan. A project of this size is detail-oriented, and we are trying to address a lot of needs so that we maximize the taxpayer dollars that we are investing in our community. Before I review our overall plan and the amazing things we're able to accomplish, let me reassure you that our building is a sound structure. As part of our initial planning, we studied the feasibility of building a new hospital at a new location and found that the costs were prohibitive. Staying put, however, doesn't mean that we can stand still. It is essential that we make much needed improvements, including upgrades to the environmental system, enhancement to workflow patterns along with floor and wall updates. We plan to add 14,000 square feet combined to upper and lower floors to expand private nursing home rooms and centralize all business, billing, and administration to the top floor. We will remodel hospital rooms and increase storage and supply areas, increase off-street parking, remove the old trailer being used by physical therapy, and build a new building where the administration annex is now. We will also create a new Pink Ladies gift shop and build a modest chapel for reflections. Besides bringing our hospital into the 21st century, these improvements will help us recruit and retain doctors, nurses, and staff. Fewer people are entering this field, so to stay competitive in this area is a very real concern. The cost for a 20-year bond to achieve this modernization will be $1 per $1,000 of assessed value of your home after your homeowner's exemption. For example, if your home's assessed value is $100,000, your payment after your homeowner's exemption would be about $4 per month.
One of the key renovations to the hospital is a much-needed upgrade to the emergency room entrance. This will include a covered ambulance portico and a centralized nurse station. These will greatly enhance patient care during emergencies. The plan also calls for moving the helipad to the top floor for faster, direct emergency access.
When a life-threatening emergency strikes, you feel blessed to have the quality care close to home. Tim and I have had a few close calls over the years and really appreciate the superb care we've received. The majority of people in our community haven't been in the hospital, and that's actually a good thing because they haven't needed care. But those of us that have recognize that renovations are needed to help patients like us and the tremendous staff at Power County Hospital overcome the limitations of our current facility. Our younger population is expanding, and our older population is growing as well. More and more of us will be using the hospital than ever before.
On May 16th, we will all have the opportunity to make these improvements to our hospital a reality when we go to the ballot box. The Board of Trustees and myself sincerely appreciate your interest and your consideration.